But yeah, and then, when you look at like how to do your dullness and how to do your sagness, it's like know that too, because that's where those chemical peels are going to come in really well too, because it's going to help to stimulate those fibroblasts to really help collagen and elastin. And it's going to clean off and produce new skin cells, which is going to even out your tone and texture. So, it's going to help all of that. And I think that's what people don't understand. And it kind of goes to what we talked about before, too, when we talked about being able to do toxins at the same time that you do chemical peels. And why that is important.
Tell me the layering. So what's the protocol when we're doing tox? Because you can do your tox, your filler, and your chemical peel
at the same time.
At the same time.
Appointment.
Same treatment.
Right.
You don't need to send the patient home to come back 2 weeks. You can do it all in same treatment.
At the same time. And
what's the best protocol of layering?
And why is that important too? Is that your patients don't have time to come in every single day.
Yes.
So this is like if you can layer it from just on how you're going to look, you're going to get so much done at one appointment.
Yes, and results are going to be so much better.
And I always laugh and say, like, everyone loves their tox. It lifts, it smooths, it's great. People love it. But your tox is only as good as the skin you're injecting into.
I couldn't agree more.
So if you're dull, if you've got, dead skin cell buildup, uneven tone and texture, a lot of, hyperpigmentation, melasma, that's where that chemical peel is going to come into play. It both takes about 5 to 7 days to kick in. So when you do that, you look like this brand new person. And what I found is that when people do it, they actually keep up with their tox a lot better. They keep up with their home care because they've never had a tox experience like this before, where their skin actually
is
super
so much
glowing.
more elevated. So the experience is just so much
and people
better,
notice.
higher.
Yeah,
people notice.
And it's awesome. So you do your peel. That's your most important thing. I always make sure that they've had a peel beforehand. Like everything's fine, everything's great. Like I never like to do any type of stackable things at the first appointment.
If they've never done it before.
If they've never done anything before.
That's
but
awesome
if they've had
highlight.
toxins and things before and they've had a peel before, definitely you can do it together.
Okay.
So you're going to come in, you're going to do, and then make sure it's the right type of peel that you can do it with. So for instance, the Perfect Derma Peel, you can do your toxins at the same time.
You can.
You can.
Oh, yes.
So, and so with it, you can do it, we call it the perfect tox.
Perfect tox.
The perfect tox. So when you
result.
do those layers of a chemical peel, and most chemical peels have anywhere from 4 to 8 layers that you put on the skin.
Yeah, about 4 to 8.
You're going to stop right at the end, like right before you get to that last pass that you're doing, and that's when you're going to set your patient up. And when you set your patient up, they are ready to go. It's a vasoconstrictor, so we minimize pinprick bleeding, we minimize bruising. We have a little phenol in our peel, so it's going to help.
Numbing.
It's going to be numbing to the skin and make it a better experience for you.
Yeah.
And then you can go straight in
and that numbing time you cut also.
That numbing time you cut too.
From
because
peeling
now
before.
if you're doing like a lot of like a lip filler or something, you're still going to want to do the lidocaine and stuff.
Right.
But you can put that
it's
on
not
the
going
lips
to the lip. Yeah.
while you're doing doing your peel, and then they're numbing. It's numbing while you're taking care of doing the peel. And then you're ready to go. If you mark, you can still mark. Sometimes they say the white kind of pencil doesn't show up. Use an expo marker. And then instead of using an alcohol swab, you don't need to do that. Our peels are antimicrobial.
Yes.
So you are ready to go.
You're ready to go.
So you set your patient up, you inject them, and then you take that little left of what's left of the peel and you touch up those injection sites. And then you just do a thin, like kind of cleaning pass, over it, because you never want to press in wherever you have any type of toxins.
Right.
So let's say we just do the upper. So let's just say we're doing like a little eye lift and, smoothing out like the 11s right here. You can still press in on that chemical peel on your neck and on your neck and your lower cheeks and jawline.
Okay.
And then you would just do a very thin cleaning pass going over the top. If you do it all, if you want the Nefertiti and you want the, the jaws and you want the eye, then you're just going to do a cleaning pass right down at the end and they're good to go. Keep them setting up. That's the most important thing. We never want anyone to lie down after they've had tox.
Right.
But, the same thing. You can't go out and work out right after you have toxins, just like you can't go work after that. So from a patient the standpoint on what's going to make their life easier, doing these things together work really, really well.
It does work well. Wow. What conditions, what skin conditions have you seen the chemical peels treat?
So,
from acne, hypopigmentation.
Pretty much it can treat like anything. So
large pores, does it help?
Large pores. And that's where like there's like with the Perfect Derma Peel, there's some boosters that you can get in. Other peels, the same thing too. You want to pick the right peel. That's what I always say. I always say there's 3 things that give you a good peel. Degreasing that skin, pressing and, really pushing that peel into the skin and picking that right peel for that patient. So when it looks for what it is you want to fix. So are you worried about aging? Are you worried about those droopy jowls, the loss of collagen, the loss of elastin? Because we don't make collagen after 30.
That's right.
Are we worried about like how everything just kind of drops now? Are we worried about our pores? Are we worried about, acne scarring? Are we worried about hyperpigmentation? Do we have melasma? Do we have brown spots? Do we have a little bit of everything? That's going to determine kind of like what peel you're going to do. And then you might be worried about both. I worry about my sun damage, but I also worry about aging because I'm in my 50s. So like I want to make sure that my skin, kind of combats that aging during certain times. But as we're getting into the summer months, I also want to make sure that you can hit the sun because I am going to be outside. You just can't help it. Right. And so that's when I kind of go more into using a peel that might have a hydroquinone in it. So, and I think that, leads us into peeling in summer. I think so many people think that you can't have a chemical peel in the summer.
I was going to ask you that. What are you going to tell to our providers about peels and the summer coming up? Should we stop using peels?
In my personal opinion, I think peeling in the summer, if you live in the Midwest, is the most important time to peel. And why is that?
You recommended that I do a peel during a summer and my skin, see how dark I am. I'm 506 and nothing happened. Right. I guess it also comes down to using the right peel. And
the right peel, the right protocol. And making sure your patient's compliant. I mean, I think we always have to think about that. But I always tell people, in the Midwest, we don't see the sun. Okay. It's 50 degrees outside today.
Yeah, today it's really cold. It's cold. It's end of May.
We just don't see sun. So when we see the sun here in the Midwest, we go out in it. We want to be outside. We want to be in the warm. We don't have the privilege of being in sunshine all the time. When you see people that live in Florida, Arizona, California, Texas, when it's 100 degrees, 80 degrees and super sunny, they don't go outside. They're not going to the beach. We are. We are going to be out there and we are going to be in the elements. Yes. That means we're getting more sun exposure and we're damaging our skin more than these people that are not going out. So why is it then important that we get these peels in the summer? Because we have worked on our skin from September to May. And then we're just going to stop. So everything we did, all that money we spent is for what? Because then when we come back in September, we're going to have to restart that whole process over again. Yes. We're going to have to fix all that, that sun damage. We're going to have to fix the acne.
I never believe in stopping everything during the summer. I mean, we see patients do it. They just want to stop during the summer. But why? Well, just to start over in the fall. Right. No, you got to continue treatment.
And I think they just think like, well, you say I can't go out in the sun. Well, no, I don't want you on your Caribbean beach vacation this week getting a peel.
Right after a peel.
Or maybe, that week. Or like if you're going to a big 4th of July, pool party, maybe you don't get it the 4th of July. I completely agree with that. But those 2 weeks before or 2 weeks after, I think are perfect. Most of us work every single day. It's not like we're at the pool every single day of our, every single day of the summer anyways. And if we are, and we're really truly worried about aging, we should have sunglasses and a hat and sitting under an umbrella and protecting that skin anyways. So I can honestly tell you, I do a peel every Labor Day. I think that's it. I just keep my back to the sun. I don't get in the swimming pool. I've done peels on vacation before because, I don't care about the downtime or people seeing me peel. I just don't go sit in the sun.
Right.
So you can do that. The people that don't want to see like that peeling, maybe you are one of the people that get like that really good kind of peeling effect. Right. Just use more of the protecting cream. Use more of the Aquaphor.
Yes.
Use more of the sunscreen, and it's going to really taper it down. Common sense is pretty much what you need, but you're going to be so much happier with your skin results come September. If you keep up with your skincare regimen. And you can't do lasers in the summer. Like that's, that is something that you can't do. But, there are treatments that you can do that's going to help, and that's a chemical peel. Yeah. So, I get it if someone
Especially the one with glutathione, the kojic acid. Yeah. It's antioxidant.
And, and I get that some people are going to say like, oh, but this is my only time and I love to be outside and I don't want to give up. I don't want to do my series this time. I think that's fine. Try and get one. If you can get one in and look at it as more as your maintenance. We're going to maintenance. We're going to kind of fix what we're damaging.
Yep.
We're going to kind of keep it up, but then make sure that they have, one in September where they're back. But bring them in and do different things during that time too. So they should still be getting, some dermaplaning. They should maybe get a superficial peel. I tell a lot of people, summer's a great time for a superficial peel because at least it's keeping your stratum corneum, that glow kind of going. That with a dermaplane I think is great. PDRN at this point, I think works really, really well. The mermaid facial, it's called a mermaid facial for, I think it's perfect for the summer months because it's really going to help stimulate that collagen and elastin. But it's going to keep that patient in and keep them going because we want to make sure that they're doing something to treat their skin. And otherwise, we're starting all over again. And I think that's the biggest education. And again, I think it goes back to what we talked about in the initial is trust. Like you have to have trust between the provider and the patient.
Yes. Trust is everything.
Yeah. And
it goes a long way. I trust you in my aesthetics journey. I trust you with my melanin patients because you have taught me to do things a certain way, do it differently than how I've been taught. Even with products that you don't even personally sell, you have brought me your expertise and tell me this is how you should do it. And I have, and I've seen nothing but great results. That's why I've been with you for the past. Yeah. Trust is everything. And the same goes between us and our patients. They trust you, they're going to stay with you.
Right. Well, and when they start seeing results, when they
and
see that
when
this
they
is
start
the
seeing
treatment plan.
Yes, exactly.
And that, I use, your treatment plan. Like if you have somebody that's darker skin and they have a lot of PIH, well, that PIH did not come up overnight. So we're going to give you that plan. Maybe we need a little microneedling. Maybe we need microneedling with a chemical peel. But this is where we're going to see it, and we're going to do the pictures, and we're going to take you on this great journey and then see what it looks like afterwards.
So our patients who are watching, they're Fitzpatrick 506, our really dark patients, you can tell them that it's totally safe.
Totally safe.
To do a peel.
Totally
to
safe
renew
to
your
do
skin,
a peel.
Fix that texture.
It's really going to help with, because a lot of times too, when you have those darker Fitzpatricks, the reason their skin looks dull is that especially if the post-inflammatory hyperpigmentation is drawn from acne, they don't like to moisturize. Yeah. So when you don't moisturize,
or the oily ones, they don't want to moisturize because they think they're too oily.
Right.
But no,
and your body
you can be oily and dry. Yes. Oh, I love you talking about this.
And and you'll look ashy, and that's the biggest problem with skin of color is the ashiness that looks at it. And if you don't put some moisturizer on it, you're actually going to be more oily because our body can't
more
make moisture.
Hyperpigmented.
And more
when
hyperpigmented.
You're dry, you get darker.
Yes. Yes. So it's really important that they understand that too. And I think I think the darker Fitzpatricks get a little bit more scared because they've probably been burnt a little bit more.
Oh, they've been burnt. They've let's be honest, they've lost trust
totally
in our
lost
industry.
Trust. Right.
I know. It's bad, but yeah.
And because you have to know the differences of what you can put on and what you can't put on.
You can't.
And you have to be honest and go this is we're not gonna cure you overnight. This is what you need to do.
It takes time.
And this is how we're gonna get it off. And we're gonna show pictures and you're gonna see improvements after each treatment we do. But this is what our end results are. The end results are going to be.
Right.
And a lot of times, that's what's going to they're going to be so pleased and so happy because they're not going to look as dull. They're going to have more tightness. They're going to have more lift. They're going to have overall tone and texture, more evenness of skin tone. And their skin's not going to be as pigmented or as oily or as acne.
No.
I think there's nothing I like better than doing chemical peels on acneic patients because you can actually see those pores and the acne working. It's so satisfying.
Right. It's so satisfying. It's so satisfying. And I totally agree.
Yeah, it's amazing. And patient compliancy is another thing too. You really want to make sure the patient, is doing what they say that they're doing.
Yes.
Right.
Yeah.
And being honest with you. And I think that's the other good thing with, the chemical peels that we do is that because they were made by a Middle Eastern doctor for
who has melanin,
who was a 4.5 Fitzpatrick, they understand that importance of how that skin, how the skin's going to work.
Yes.
I just think that's kind of like a key piece of it too.
It's a key piece of it. Like everything about that peel, honestly, because I've used other peels before during my career, but nothing comes close to this one.
Right. Well, and it gives you a little good of like peace of mind, I think, too. Because a lot of times when you work with skin of color, before laser, before microneedling, before chemical peels, you have to tell them, okay, you're going to need to use like a hydroquinone or a tretinoin for 4, 6, 8 weeks before you do this, treatment. And then you just have to hope that your patient's compliant and they're telling you the truth.
Yes.
Because if they didn't.
So we don't need a prep.
We don't need a prep.
Perfect Derma
Anybody
Peel.
can walk in today into your place and get a peel. And know that they're going to be safe. You're not going to have to worry about the fact that maybe they didn't do everything they were supposed to do before. And I think that is, kind of a really key part from our side of the industry.
It is.
Of just knowing that there can be a little oops and it's still going to be okay.
That's amazing. I love that. Yeah. Let's talk PDRN.
Yes.
Melissa.
So PDRN is kind of exciting.
It is exciting. I want to talk about this one. Now, tell us, for those who don't know, what is PDRN? Is it injectables? Is it
PDRN
topical?
Is a topical cosmetic.
Okay, so it's not injected.
It can be injected, kind of off-label. We usually don't recommend that. Usually we recommend that it just goes on like topically. It is a very long word that basically means it is like works with your DNA.
Yes,
so it's a polydeoxyribonucleotides
yes, that's
something.
It. Very long
Look
word.
it up. Just go in and Google PDRN.
PDRN.
I'll tell you what it is.
Yes.
But basically it's like trout or salmon sperm.
Okay.
So you'll see a lot of people that are out there now calling it the salmon sperm facial. It's, like the big thing that's in Hollywood. So Jennifer Aniston, the Kardashians, they're it's all over TikTok and social media. Vogue magazine did. If you want a glass appearance, PDRN's the way to go. I kind of laugh and say, yes, it's the salmon sperm facial and it's kind of like trendy. But in a couple years, we'll probably be calling it just a PDRN or the mermaid facial. It truly, truly works. What it does is it helps to stimulate those fibroblasts that create collagen and elastin in the skin. Biostimulation is where it's all kind of going. That's what we want. We don't make collagen after 30.
We don't.
No.
So there has to be a way for us to get that collagen.
For us to get it and, to help with that kind of lift that we all get from aging. It works amazing. What's with salmon sperm, it has a lot of the same kind of makeup in the DNA that human has. So with that, it makes it tolerate it very well. We don't have to worry about allergies. We don't have to worry about reactions with it because it truly works the same as like our DNA. So it's, most of it comes out of Korea. Korea skincare is like probably the top of the skincare, kind of pyramid chain. Everyone loves that. It's going to give you that glass appearance because what it's going to do is it's going to help fight inflammation. It's kind of like that wound like healer. It's going to help with a glow. It's going to stimulate, again, collagen and elastin. It's going to just make you have overall great skin. Why is that important for skin of color?
Yes.
Because skin of color has so many things that cause PIH, and PIH is truly just inflammation. So whether you're looking at...
So this is also anti-inflammatory?
It's very anti-inflammatory.
Okay.
So that's going to work really well when you look at the methods of putting it on. So you can use mesotherapy, you can use microneedling, you can use microchanneling, you can use rollers, you can use ultrasonic devices. You can, anything that opens up those skin channels, you can use to put this PDRN in. And it's going to actually go down and work on that cellular surface. So just like, we could have a whole other podcast on, on why we need that inflammation in our body.
Yes.
It's the same as, think about our skin being the biggest organ. So if we don't want inflammation, and inflammation is what causes a lot of PIH in skin of color. So PDRN is great for any skin type, but it's even, better for
So this is
that.
really powerful for black and brown skin.
Very powerful.
Wow.
And especially when you combine it with like that microneedling or a microchanneling or an RF microneedling, where you do worry about some post-inflammatory hyperpigmentation when it comes to darker Fitzpatrick types.
Okay.
This is going to be kind of like a nice little thing that it's going to help with recovery. And it's going to help with that.
Do you apply it after, or is it used as a glide?
So you can use it as a glide. What I usually recommend is just to use your regular glide or a hyaluronic acid glide. And then apply this topically afterwards.
When you're done.
When you're done.
Got it.
And then you can still like apply, other things that you want, that you might want to do. You can still put a sunscreen on. you can put this on right afterwards. And then there's even some types that they have that are like boosters that you can take home and apply that goes with it as well too. But it truly is a game changer. I mean, I think that this is where the industry is kind of heading. Yeah. I think it's a great thing for people to do. There's no downtime with it.
There's no downtime.
Like there's no downtime. So if you use, you can use red light, blue light with it. So it's going to help with hyperpigmentation. It's going to help.
So you
with
apply
acne.
the PDRN
and then you
just
can do
put them under the red light.
Put them under the red light or the blue light if they have acne.
Or the blue light if they have acne.
Yeah, and it's going to really help like work down at that cellular level. There's a lot of people that can't have lasers, microneedling, chemical peels, toxins. This gives them a treatment that they actually can have that's going to help stimulate collagen and elastin in their skin, as well as give them kind of like that glass glow appearance, help deflate inflammation. And I think that's like the key too. We all want to help get the inflammation out of our body.
Yes.
So I think it's
is
super exciting.
Yeah. This is really exciting.
Yeah.
Wow.
And they have different types of boosters that you can even add to it. So they have some that promote collagen. They have some that give you like, again, that glass appearance. They have some that help with a firming essence type product.
Okay.
So different things too that you can really treat that patient's need specifically on what's bringing them in there for. So if you need extra hydration, we've got one for that. If you need one that is more like firming and toning, there's a great one, that can go in for that one.
Are there PDRN for office use and some for home use, or is it the same?
So there is some for, I would say mostly it should be used in the office, like as an office use product, and not as much as a take home unless it's kind of like a cream.
And how often in office should they come for that?
I think it just depends on what you're doing. If you're doing it with a microneedling, then you're going to stay with your microneedling protocol. 30 days. But if you're doing with something like an ultrasonic machine or an injecting or a light, I think every 2 weeks you could probably do it. You can use it, that first week when your channels are still open.
Yes.
You can put it on. So I have seen people that have like sent the patient home with some products to use that entire week. But this is definitely, beneficial when you do it as an office.
And it can be combined with your tox filler.
Like it can be and combined with everything that goes with it.
That goes with it.
Yep.
You fill tox and then send them home, apply their PDRN and go home with it.
Now, I would not do this immediately after you do a chemical peel.
Good point.
With the chemical peels, there's usually
it needs to neutralize.
And most of them are, most of the peels are self-neutralizing.
So
day 3,
no PDRN after chemical peel.
But you could bring them in day 3.
Okay.
Day 4 when their skin and they're starting to peel and their skin's open. You could, bring them in, or day 5, day 7, and do that, do it with it too.
That might actually elevate the results doing that.
Right. And, speed up like that and really help with the inflammation.